I'm gonna just quickly show you guys. We have a room full of veterans from the student veteran. Uh,
Oh, fantastic.
yeah.
Hello, hello.
We're the student veterans of America here at Fordham University, and we did this film screening because there's a lot of veterans that have chronic pain, so we kind of wanted to just spread awareness and let them know that there's other options other than just taking medications and going to the VA and essentially getting told nothing. So we appreciate you guys for coming here. Thank you for taking time out of your day to talk to us, and we look forward to it. So thank you, Kent.
Awesome. Okay. Thanks, George. Thanks for that introduction, George. I'm really so glad to be presenting the film with veterans. We've been wanting to actually do this for a long time now. We're really lucky today to have Dr. Brandon Yarnes, who is a psychiatrist and assistant professor in the Department of Psychiatry and Biobehavioral Sciences at UCLA. The main focus of Dr. Yarnes' career has been practicing, teaching, and researching emotional awareness and expression therapy, which is the therapy we just saw in the film, and to help resolve chronic pain in veterans. His randomized controlled clinical trial published in 2024 in JAMA Network Open showed that EAET is effective in reducing chronic pain. We also have with us Glendon Hockman, who served in the U.S. Marine Corps from 2016 to 2020 as a Barracks Manager in North Carolina, and also worked as a hazardous material specialist. Glendon struggled with debilitating chronic pain, digestive issues, and rashes during and after service. Through the Detroit VA and a program called Unlearning Pain, he discovered neuroplasticity approaches that helped him recover. He went from struggling to hold down a job to transforming his health and restoring his quality of life. So thanks, Glendon. Thanks, Dr. Yarnes, for being here. Brandon, I want to start with you. For veterans who just watched the film, there's no veteran story in the film, right? So,
Right, right.
and veterans have really different experiences with chronic pain, or can have very different experiences that often can involve, combat injuries and really serious falls and like damage, and then pain grows out from that damage. So I wonder if you can orient us and start to relate the film to common veteran experiences, since you work with so many veterans all the time.
Oh, absolutely. Yes. And thank you so much for inviting me, Kent. It's a pleasure to be here speaking with you all tonight. And yes, I have worked with veterans for almost 10 years now in the EAET modality that you saw in the movie we just watched. And so I'm thrilled to try to make that connection for you to the veteran story and the veteran experience, because I think typically we encounter many veterans who have had some sort of injury as part of their service. And so they've fallen off a tank, or they've had a blast injury, or they've had um, uh, other kinds of injuries that maybe are not so visible as well, that we all know about, like traumatic brain injury, like PTSD. And so the etiology or the cause of those kinds of illnesses are not always obvious, although sometimes they can be. Sometimes veterans can have damage to their spine. So one thing in the movie that I thought was interesting is Howard talked about the minor abnormalities in the spine, in the back, that we see so often. And all veterans have these. I mean, so it's very complicated. Research shows veterans have more pain. They have more severe pain than civilians. And so it is a very special population. But I would say in my clinical trial that Kent mentioned, and in treating veterans in with these kinds of tools, I've seen about 2/3 of veterans have a clinical response to EAET. In spite of all of the complexity and the severity of the veterans that I see. And it's a process, and sometimes they come in skeptical, like you saw people in the movie. And our program that we do is actually 9 sessions rather than 4, as you saw in the movie. And by the end, though, we have a good response, I'd say, from 2/3, and then about 20% in my studies of veterans have a major response, like a real life-changing response that's lasting. So in my recent clinical trial that Kent mentioned, we had a 6-month follow-up period, not a year like in the movie, but we had a 6-month follow-up period. And between 12 and 40% of veterans had a robust response, a noticeable response, all the way up to almost complete response, complete resolution of their chronic pain. So those are just kind of the numbers that we've been working with veterans and how they can respond. We can get into some more of the details of working with veterans and the stories I've heard. If you'd like, Kent, just let me know.
Okay, great. Yeah, we might have time for that in a little while. I want to bring in Glendon into the conversation. So, Glendon, can you talk about your experience having chronic symptoms and then discovering and going through this sort of unlearn your pain treatment?
Yeah, absolutely. And I want to start off by saying thank you for having me. This has been a great experience, and I met a lot of great people along the way. In 2016, I served in Cherry Point, and I met a lot of individuals, and I was a really big unit person. I ended up doing barracks management, so I was really, really the person that talked to everyone. And I didn't really realize this at the time, but I was prone to a lot of injuries. I fell off third deck in a hurricane, knocked my spine, and had a couple concussions a couple times. And then I started getting real allergic to rashes and stuff. And I wasn't really thinking about it at the time. And I had a lot of stressors in my life. And when I got out of the Marine Corps, these conditions, they kept with me and they got worse. And the allergies got worse and I couldn't work and it was a struggle to work and all these things. And I started to not know if the pain was real. And then I started to, I forget exactly how, but I bumped into the Unlearn Your Pain and Dr. Howard Schooner and went through those resources. And it really helped me understand the emotions that I was going through. And since then, I'm able to get a job. I'm able to talk to people. I still have the pain, but it is very helpful. I don't have the rashes that I break out anymore, and I can feel like I eat. I have a lot of spine and neck pain, and it's funny that Brandon brought up that all Marines and veterans and military people kind of have that, and it's true. I could feel the pain where my spines are, and the X-rays would show them up. But when I really started to feel the emotional stressors and really deal with what I was going through, you understand that the emotion and pain and it's linked. And for me, a big thing is it was free. So it was a very easy control, something I could control. And I really like that aspect. And I really feel that it's turned my life around. So awesome. If there's anything else you want to know, like some of the pains that I was going through or how the rashes affected me or how the digestive issues, I would drop weight. At one point, I dropped 60 pounds and I couldn't walk, and the muscles on one side, all rashes up to here and on the back. And people didn't know if it was shingles or poison ivy or if it was allergic. I got a true test and 12 different allergies pop. And once I started to calm down and really reflect everything that I was going through, it's a lot to experience all that. And it's a lot in my Marine Corps career that a lot of death and stuff that in my where I work now is affecting me. So I dealt with all that, and it's been amazing. The pain's still there, but it doesn't affect me as it did. And any service member who goes out and does what they do, I have respect for them. And it's so hard what we do in the military that absolutely affect us. So if there's help, I can help anyone absolutely. So that's basically my story. I went through 4 years of falling and little injuries, and the worst thing is the unknowing. But there are people, like you said, here that will walk us through it and kind of figure out what's going on. And you have a lot more control in your life, and it all affects everything. Everything affects all. It's all related. So that's kind of my story and my experiences with the pain. The pain was real. Was Howard Spooner? He says the pain is real. That was really wake up call for me when he said that. What you're experiencing is very real, and we have control over it.
Yeah, thanks, Glendon, for sharing that. I wanted to ask a little more, if you don't mind sharing some more around. I remember you talked about how, when you worked as a barracks and managing, like you would have people who get deployed and sometimes you would experience losses, right? And then later you realize there was a connection. Could you talk some about that?
Sure. Yeah, I can talk about that. Well, one of the big things that impacted me is there was a man or a guy that I used to hang out with, and we went into the military. His name was Siddiqui, and it hit me kind of hard. He didn't make it through boot camp. That was the start, and then I had similar experiences like that in the barracks managing in Cherry Point, where I'd take care of a Marine and maybe suicide, or they would go onto a deployment and something would happen, an injury or something like that. And it really affected me when I got home. And I didn't realize this when I worked at Home Depot. And I had worked at the same places that one of those Marines worked there before he went into the Corps. And, I remember the day of my injury, I felt it in my spine. And this was one of the breakthrough moments with my therapist, Kelly Bessingham, amazing. I had bent down, I was picking and I was struggling. I had all the rashes breaking out. And I remember this is feeling just like it was in the Marine Corps. And, he had worked at that building. So I was thinking about it that day. And, that's the day that I ripped something. I broke out so many rashes. I lost all that weight and my spine was hurt. And it took me a little bit to understand that, a lot of the things that I dealt with in my military career, did bleed over. And sometimes it was in the back of my mind, like here it was thinking about it all the time, but not really thinking about it because I had chose to work in a place, and I didn't have my feelings, truly understanding how I felt about it. And I would push too much, and I really am allergic to some stuff. So I would push through it and touch all the stuff, and I would break out. And I still break out time to time today, but it's not as dramatic as it was. And when I see people die or get hurt, it does affect me, and I have to take a breather. But it's good. It's this class has really helped. The pain is real, the allergies are real, the spine pain is real, but they heal. All injuries heal. So it's really important to remember these things and keep on going on.
I wanted to transition and ask Brandon about injuries and like common military injuries and how you've seen people make recoveries even after they've had 10 years of pain. It feels like this injury has never gotten better and that they'll be stuck with this forever. What stories have you seen around that kind of issue?
Oh yeah, absolutely. The average in my studies of veterans with pain was actually over 20 years, 23 years, I believe. And so veterans come in with a high degree of medical attention that they've received, sometimes multiple surgeries. One gentleman we had recently had 4 surgeries on the same disc. Now, Howard said in the movie, that degenerative disc disease is very common. It's in 30% of 20-year-olds. However, this veteran had been through 4 different surgeries on the same disc and was, of course, still in pain because he was coming to see me. And what we do in EAET that I think is really important is one of the experts that was interviewed in the movie said, well, I can't see how it would be like one treatment approach would be for a majority of patients. But what we really do is individualized treatment, right? So a veteran comes in and we want to work with them and figure out, okay, so you have the disc and that's one diagnosis you've received, but let's talk about your life. Let's talk about what's going on in your relationships. Let's talk about the accident that you had, the veteran that had an injury at a warehouse actually in the military. And so let's talk about who was there for you afterwards, after the injury, who took care of you, who looked after you, and who looked after you earlier in life as well. Who was there when you fell down and got hurt? And so we often find that it's not what happens so much as what happens afterwards in the caretaking. And so let's see, I remember another veteran we had recently that had an injury to his foot. And he recalled in childhood, he fell off his bike and broke his foot. And he walked up the hill, had to walk up the hill to get home. And his mom looked at it and said, yeah, let's keep an eye on it. Wait till tomorrow. And so he had to wait and it was swelling up. And before he went into the doctor, and they said, yes, your foot is broken. Oh my goodness, why didn't you come in immediately? And so his attitude when he got the second injury in the military was he had like taken up that stance that his mother had of, well, walk it off. But his foot was again broken for the second time. And so it's a process of like reawakening. I know in the movie there's the talk of anger, but it's reawakening that caring for the hurt that you've had, that compassion, that self-care, and being able to provide yourself that when you didn't exactly maybe learn that at home. And I think that really does parallel to like the case in the movie of Tony, where he had suffered this emotional loss with his friend Vinny. And then what happened? It sounded like maybe he was told, oh, just go back to school, right? So what was the process of like grieving that loss, of like passing through the normal stages of the pain that are inevitable when we have a physical injury or an emotional injury? We have to pass through that grieving process, or else that can get stuck in our bodies. And that can happen to all of us, veteran or non-veteran.
Yeah, thank you for that. Yeah, I wanted to ask you another question around, so much of the work of working through a mind-body issue is noticing emotions that are under the surface, whether that's
right,
anger, it could be guilt, it could be grief, it could be shame, it could be many things. And with veterans, sometimes they have experienced combat, they have experienced violence, they have sometimes used violence. And so anger has a different meaning than for other groups of people sometimes. And I'm curious, could you talk about if somebody's like, oh, I have to be careful, I have to keep a lid on my anger, I don't want to go there, I've seen shit happen. Like, how do you think about that working with veterans?
right. And a lot of people, veteran and non-veteran, tie anger in their mind. It's tied to experiences of violence. So people can see like stepfather, like you heard in the movie, get angry and violent, right? And they can have. We had a veteran who had seen like violence at home with his stepfather, and he actually took a rocking chair and broke it over his stepfather's back when he was a little boy, because he was so enraged because this stepfather would wake him up beating his mother in the middle of the night. So these stories, I mean, this was a veteran that I had worked with, but I mean, they're so poignant in the military and out of the military. We have had veterans who have killed people in the military. I've also had at least 2 who have admitted to stabbing someone or shooting someone outside of the military in civilian life. And so when there is an invitation to look at anger in the group, there is an extraordinary lid that is put on that experience. And I think it was well put in the movie about fear and the role of fear. And sometimes you can be so scared of your anger that it's going to lead to violence, because you have that in you because you've done it before, that it gets buried even deeper in these kinds of people who have experienced these things like I'm talking about. And the thing that I say is that, well, there is still violence going on, but it's going on against you. It's going on inside you, right? you are being hurt. You are in pain now every day. You're not inflicting pain on anyone else. That was in the case of my veteran who shot someone. That was literally, I think it was 56 years earlier than the present day. And he went to prison and he was punished for that. And now the violence was toward himself. So like, can you now try to work with me to get this violence out and gone in a way where no one gets hurt and it's final once and for all? And I think a lot of veterans respond to that, and we are able to help.
Glendon, I was curious to hear some of your reflections on, working with emotions, working with character traits that are common for people with chronic pain. We know like people often have a tendency to people please, and if somebody asks for something you don't want to do, you just do it because you don't, that kind of thing. What kinds of stuff did you work through in your program?
So it's excellent you brought up emotions and anger and stuff, Brandon. And to answer your question, I worked through a lot of that. I worked through mainly my issue was people pleasing that you brought up. I had a tough time with that and avoidance. And what I found was it was tied into other emotions like anger and grief. But I was so avoidant with people. Like I wouldn't go to certain stores or certain hours of the night or eat certain areas because I was reminded of some of people that I worked with in my military career, and that goes back to my emotional trauma as a kid, where bottles were being thrown and stuff. So I always had this pressure of like being an adult and trying to stop all conflict. So I was very avoidant because I don't like conflict. And in the Marine Corps, being a barracks manager and a people pleaser, I was always doing my all to really make sure everyone's tools worked, everyone's beds worked, everyone was getting where they needed to be on time, coming back with their families on time. And I didn't really realize that in my career until I got out, but it never turned off. So I had stuff that was kind of me from my core, from my childhood. And then the Marine Corps, I kind of had it, just got built and secured it. And when I came out in the civilian, going extra, I was doing volunteering for holidays, everything. I mean, you name it, I was the guy, and that was just eating me alive because I couldn't. At Home Depot, we lost someone, he got hurt, so I did everything safety so no one could get hurt. I worked at AJM, and we had the reported death in the company, so that hurt me really good, and I was busted, and that's where I got hurt with a lot of my injuries again. But I found out that it was avoidance, so I stopped trying to avoid stuff. And Kelly Bessingham told me, what feelings am I feeling? And it was a lot of times it was sorrow, guilt, shame that would make me push myself or avoid situations. And there was anger behind it, but it wasn't so much like I was angry. It was like I was angry that these things would happen. So it was more like sorrow and those type of feelings. And it played 100% into digestive. I have digestion issues, but it played 100%. It would make them worse. It would make the rashes worse. It would make the feeling of eggshells. And it was until that emotional chart, there's stages of emotions through the class of some with Dr. Howard Schumer helps. Dr. Howard Schumer has talked about. There's stages of emotion that really helped me. And it starts in small steps, recognizing that you're doing these things, recognizing that I was being avoided in ways that I wouldn't eat in certain times. I wouldn't go to certain places like Home Depot because my friend was there or was there. Even certain medical facilities, because I knew where everyone was living state to state. I wouldn't go to certain doctor's office because I knew Navy people that worked there, and I had seen them choke people or choke me, or and all these things were making it worse. I was really not even getting the help I needed because I was so afraid. So until I dealt with these, I wouldn't touch at work. I couldn't touch garden supplies because I would break out every time because I'm allergic to rubber, and I am. But that was fear, because in the military I had an accident where I had a bunch of chemicals spill on me and it kind of messed me up. But I was afraid ever since that. So every time I would work in areas, these stressful areas, I was touching metal and breaking out until I understood people pleasing. If now I just explain, hey, I can do it, but I have to take a break sometimes or wash my hands. And life is a lot better. I can eat things I didn't think I could eat again. I can touch things I didn't think I could touch again, like lawnmower belts. I have to kind of wear gloves sometimes, but I couldn't do that before at all. And that's kind of how, in my experience, like people pleasing and other emotions, like anger is a really good one, but it was avoidant, really big avoidance, and I didn't realize it at first.
Thanks, Glendon. I want to open it up to the floor here. Are there any questions you guys are dying to ask in the room here? Or also people on Zoom are also welcome to ask a question. We'll start with the room though.
All right, so hi guys, thank you for being able to participate. Really appreciate it. It's always good to I guess hear other people talk about other ways of get treatment and whatnot. So my question is, I do have chronic pain, and for years I was able to identify. I understand a big part, I think, of my stressors are like some of the events that happened to me in the military, outside the military, and I was able to identify a few of them. And I came to US when I was 14 from like a very small village in Poland, and and realized that I go to like therapy a lot, and how do I balance against the trauma that you may experience in the military and maybe trauma that experienced in childhood or along, during your life in general, right? How do you know what might be causing the pain, if anything, I feel like after watching the movie, after the documentary, I was able to kind of see that, some of it probably is, if not a lot, probably even a lot is maybe like a trigger. I just don't know what the trigger is, but I feel my body just tense up. My back hurts like all across mid back, pain, and I'm trying to stretch it, can't stretch it. And whenever that like dull pain that's like doesn't go away, it makes me like pale, and then all day I know it's gonna happen because at the end of the day I'm gonna have to vomit. I'm gonna have to vomit until it just like the pain goes away. And so yeah, if you have, I guess, where do you start? Identifying what works, what doesn't. Sorry, it's a long question, but
no, it's an excellent question. Where do I start? I'm on board. I'm starting to get used to this. Maybe I see myself in some of these stories that you just watched. And so if I were working with you as your therapist, which I'm not, we're just on a show here, but I would say the place to start is whatever comes to mind first. We have to start somewhere. So we would try to choose a specific example, a specific relationship, a specific thing that happened. And I would ask you to choose a specific event, a specific relationship, and we would begin to work with the feelings there. Because it really is all layers, what you're talking about, right? So whatever the stress is in your life now, and under that may be your military experience, and under that may be your experience before age 14 in Poland with early childhood stuff. And it's all going to be connected, right? It's not going to be one thing that goes with one symptom and another thing that goes with another symptom. All of that is holding together as part of a whole, I would say. And so we have to like crack into it somewhere with an example. And so oftentimes where we start, like with our veterans, we start with something that's going to get their feet wet with emotion. So like I'm in LA, and so we have traffic, and oftentimes it's just like somebody cut them off on the way driving in to the session today. And so something to get them emotionally activated, emotionally engaged. And once you get the emotions flowing, then it's amazing how your mind just kind of expands and these things come up that you haven't thought about before. And I thought there were a couple good examples of that in the movie. gosh, I think one was with Kim when she made a comment about, oh, I've never put that together before, when she was talking about anger toward her father, right? So you get emotionally engaged like she was in that moment, and there were tears, and she was getting anger towards her father, and she thinks of things and memories come up that are new, that she hasn't ever thought before. She hasn't ever connected before. And the pieces of the puzzle kind of come together through that process. And I think you can start with Howard's book, or some other books, resources that Kent may be able to pass along to you. And then if once you start working on your own, you can then think about maybe getting a therapist, finding a good therapist that could help you work through it as well.
So I have three questions. And they're simple. My first question is, how much of this is related to actual physical health? Because a lot of the patients in the documentary were obviously a little unhealthy. Do you guys advocate for physical health whenever you're doing the treatment? Do you give them advice? That's the first question. My second question is this program remote? Can people do this remotely, or do they have to do it in person? And my third question is, what do you do when people have a medication addiction? Do you advise them to wean off of the medication? Do you tell them to go to a rehabilitation clinic to seek advice there? Or do you advise them just to quit cold turkey?
Yeah, so the first question is, physical health is extremely important as well, and definitely, definitely am all for it. Right, what you're saying: exercise, get out, walk. Do everything you can to promote your physical health and healthy eating as well. I'm all for it. But what we work with EAET, emotional awareness and expression therapy, again, what my view is, working in that way, that all of these things are connected, right? The way that you treat yourself in terms of, self-compassion, in terms of looking out for yourself, that works emotionally, and in terms of the way you treat your body in other ways as well, in terms of eating and exercise and that kind of thing. So if we can get people on an emotional level motivated to care for their feelings, to care for their pain, their anger, their guilt, their shame, to take care of that and to heal those things, then that is going to spread out into all of the other areas of their lives. That's what we're looking for, is this total transformation in the way that people care about themselves and care for themselves. That's what we're trying to do through the treatment. So I don't give advice. I don't tell people, okay, get out and walk 5 miles every day. There are other programs that you can do for chronic pain, which I'm in favor of, that do that like have specific walking programs, for instance. And again, I'm all for it. That's not what I do specifically. So in regard to your second question, I'm going to come back to that one because I don't remember it. I will go to the third question on medication. So yeah, I don't deal with patients myself. I don't deal with patients that have like a formal addiction, right? But we do have patients that are on opioid painkillers and are taking other pain medications. And it's something that we monitor and keep an eye on in the EAET treatment. And we hope that as we're able to heal this pain through the methods you saw in the video, that they will want to go down on their medication. They'll want to cut down. And so even if their body is tolerant of the medication and used to the medication, right? I wouldn't say like formally addicted, but their body is used to having this medication on board, they will have to go down slowly, right, on these opioid pain medications to get themselves off. And that'll have to be a process they'll have to work through with their doctor outside of the EAET treatment. But we hope that what we're doing is going to improve their motivation to do that and lessen their need to be on a lot of pain medication. So now the second question.
The second question Yeah, so the second question was, is the program remote or is it
Oh, yes, yes.
only done in
So
person?
yeah, I was very skeptical in 2020 that we could do it remotely, because I've been doing it for several years before that, and in-person groups like Howard did in the movie. That was what I was doing as well. And so when 2020 hit, I actually got funding to study doing groups virtually like this. And I was shocked, because you're probably not going to be shocked to hear this after what I said about LA and the traffic, but our attendance was much better on the virtual groups. People attended almost all the sessions on average. And then as a result, our outcomes were actually better doing the groups virtually than what we had been doing in person. And so the study that was published last year was finishing our in-person groups, but we're now in the middle of another study with veterans that is entirely doing groups virtually. So that should be, if you stay tuned, coming out in a couple more years. We also just got another score from a grant proposal today that was scored very well. And so if we do end up getting funded for that, we will be doing this not just with veterans in Los Angeles, but at 7 different VAs around the country. And I think we're primarily going to be doing virtual groups if we do proceed with that study as well. So absolutely, it can be done virtually.
Yeah, I'd like to add to that if you let me. Yeah, so when I actually started just to go off, he said the remote thing. When I actually started, I was doing it in person, and it was kind of added to my stressors because I was an avoidant and people pleaser. If I couldn't show up to the class, it beat me up, so I had to show up, even though I should have been calling off. And my therapist actually had to tell me at one point, "Hey, man, just take life how it is. If you have to call up, you have to call up." And we switched virtually. And like you said, it's my attendance improved, my experience improved. It was just, I found it to be, the virtual was very easy. And I know some people prefer going in, but it worked very well for me, and it's a great avenue. I just wanted to add that. Oh, and it was Adrian. If I could ask one question to Adrian, because he said, "Where do I start?" In my experience, if you allow me, I was kind of in the unknown. I didn't know where to start either. And my therapist, Kelly, he basically said, "It's okay, just kind of start where I can," because it was so unknown for me, and I didn't know what I was even stressed about. I didn't even know I was avoidant. I was wearing sunglasses. I was so avoidant, and there was a moment it just clicked for me. I just understood it. I just kind of understood, and I just wanted to kind of explore that. And what my therapist told me, it really, really helped me, is when you have these feelings of pain, just write down what you were feeling that day, and then just go back to it later. And you'll find something, you'll find connections. Because he told me, I was in so much pain, and there would be days I'd be sweating, and people would call ambulances for me. And I'd be like, no, don't call an ambulance. I'm not that sick, but I'm like passing out. It's okay. Like, dude, you're coughing blood. It's okay. It was okay. And I'm allergic to some things in the air. And but now I'm good. And I didn't know what was causing it and triggered. So what I was feeling that day, all stressors, I woke up, I went to sleep, I had a tummy ache. I mean, all stressors play on the body. And that's where I started, is what makes it worse? What makes it better? How did I feel that day? And to me, that was where I started. But it's different for every person. And that's where a lot of my pains were.
Thanks, Glendon. Okay, if there's anyone on Zoom who wants to ask a question, feel free to unmute yourself. Hi, Kayla.
Hi, Kent. Can everyone hear me all right?
Yeah, we can hear you great.
Thank you. I wish I could have joined in person, but I still watched the video or the movie, and Kent, wow, what a great movie. I definitely learned a lot. And it's kind of insane that we as veterans, since we experience so much pain, as we discussed earlier, that this type of resource or this treatment really isn't, more, known. Because I definitely have a lot of friends, as I'm sure we all do, that experience some sort of physical pain. When we go to the doctor's appointments, we get the MRIs, we get the X-rays, and sometimes it's like, oh, like, am I just making this shit up? Nothing's like showing up, nothing's helping. And luckily, us veterans have UCANT to help us out. But I guess my question would be, if I were to run into some veteran out on the street, I learn that they're experiencing chronic pain, like what can I do to help them? Like, is there any resources that I could refer them to? I'm obviously not a doctor, so I can't diagnose or I can't, tell them what to do or not to do, but just in case, like what are some educational resources I can point them to, or like anything like VA related here in New York? Like, I'm not sure if you guys know since you're not from New York, but if you know anything, that'd be great.
Yeah, well, I would be curious if Brandon probably gets asked this question more than I do. I'm curious if you have your sort of go-to recommendations for people.
So I mean, if you are talking about other friends of yours who are veterans or not, anybody with chronic pain, I would recommend them to watch, Kent and Howard's movie, because it's something that once you see, it's hard to unsee. When you see these people and what they go through in Howard's program and the transformation that they have, and it's told in such a beautiful and poignant way through the movie. So I think getting our folks with chronic pain over the skepticism that wants to keep this out completely because of other medical diagnoses or what may be on an MRI or an X-ray, but opening them up in their mind and their heart to, oh, this may be actually what I'm going through. I think that is a really essential step that nearly all of the patients I've worked with have had to go through at the very beginning. But once they're at that stage where they're really ready to start working, they're like, yes, I do think this is me. The EAET that I use with veterans is basically Howard's book. So the handouts for the EAET group therapy model that's in our research study, all of the patient handouts, or most of them, come directly from Howard's book, Unlearn Your Pain. So I am not paid or anything by Howard to say that. I just think it's really good, and it's my first recommendation. And also, Kent's website, of course, for the movie, and also Howard has a website which is also called unlearnyourpain.com. Has a lot of information on presentations that are given publicly that Howard and other colleagues of his give that are for everyone, for the whole public. There's also a meeting that has been in Boulder last year and also is coming up. I think they're going to do it again in Boulder this September. And the whole public, patients as well as therapists and coaches and everyone, is invited to this particular meeting. So that's really what I recommend. I think the VA itself is not widely available in the VA right now. It's really select VAs where there's been a clinician who is interested and has picked it up. We do have a community of VA providers, so more that's growing like every day in leaps and bounds. People are more interested in this, but it's not available at every single VA. So, but definitely the VA people there are open to it, and it's going to be there hopefully in the coming years.
Thank you so much, Dr. Yarns. And also thank you, Glendon, for having, the courage to speak your story. It's very great. Thank you.
Thank you.
Bye, everyone.
Okay, well, we went a little over. Thanks everyone for sticking around. It was such a pleasure to host the screening. Thank you, Dr. Yarns. Thank you, Glendon, for coming. Thanks to you all for being here. I appreciate it. So thanks a lot. Have a good night, everyone.
Thank you. Thank you, Ken.
All right, thanks for having us.